Hypersensitivity reaction, an overreactive immune response to innocuous substances on re-exposure that can result in tissue damage. These reactions involve both humoral and cell-mediated responses. Types 1 through 3 are humoral-mediated and immediate, while type 4 is cell-mediated and delayed. An allergen is a molecule that triggers a hypersensitivity reaction. Type 1 hypersensitivity reaction, also known as an anaphylactic reaction, is classified as an immediate hypersensitivity reaction because it occurs within minutes after re-exposure to an allergen. After the first, or primary exposure, basophils and mast cells are sensitized with IgE. Upon second exposure, IgE binds to a specific allergen and chemical mediators are released from those cells, leading to degranulation, which causes allergic symptoms. The magnitude of the allergic response depends upon where the allergen enters the body. Individuals who exhibit symptoms are genetically predisposed to produce increased amounts of IgE to that allergen. Individuals can be exposed to allergens through the upper respiratory tract, absorption from the intestinal tract, and direct skin contact. Allergic reactions occur in tissues with many mast cells, such as the skin, nasal membranes, tongue, lungs, and gastrointestinal tract. Allergens contacting the nasal mucosa can cause a runny nose, itching eyes and nose, sneezing, and nasal congestion. Eosinophil levels in the bloodstream and nasal secretions may be elevated, and IgE may be normal or elevated. Allergens contacting the bronchus can cause asthma, with serum IgE levels usually increased. Although food allergies are common, they are the least common form of type 1 hypersensitivity reactions. Symptoms include nausea, vomiting, cramps, abdominal pain, and diarrhea within 2 hours of ingesting the allergen. Anaphylaxis is the systemic form of type 1 hypersensitivity. It can be life-threatening, causing shock or edema of the upper respiratory tract. Substances that can trigger this condition include peanuts, seafood, egg albumin, honeybee, wasp or hornet stings, vaccines, penicillins, or sulfonamides. Mediators of symptoms include histamine, which causes contraction of bronchioles and smooth muscle of blood vessels, increases capillary permeability, and increases mucus secretion in the airway. Prostaglandins cause vasodilation and increased vascular permeability. Leukotrienes cause erythema and wheal formation. They have 30 to 1,000 times the ability of histamine to cause bronchospasms and also stimulate mucus secretion in the airways. Laboratory evaluation of allergies involves measuring total serum IgE levels. Methods used include competitive radioimmunosorbent test, non-competitive RIST, double antibody radioimmunoassay, and sandwich enzyme-linked immunosorbent assay. Despite the name, radioimmunosorbent, radioisotope labels are generally no longer used. They have been replaced with enzyme-labeled assays. In the competitive assay, a quantity of labeled anti-IgE is mixed with serum containing IgE. The IgE in the patient sample competes with the labeled IgE for binding to anti-IgE attached to a solid surface, such as a microtiter plate. The more IgE present in the sample, the lower the signal produced by the label. Allergen-specific IgE is detected using the radioallergosorbent test, or RAST. This test can be performed as a competitive or non-competitive assay. Treatment for allergies often involves allergen avoidance and drug therapy. Patients can also undergo immunotherapy, commonly referred to as allergy shots. Individuals receive injections of gradually increasing concentrations of the allergen to which they are allergic. Eventually, a state of tolerance to the allergen may develop. Type 2 hypersensitivity, also known as cytotoxic reaction, is due to IgG or IgM antibodies directed against cell surface antigens. It is also an example of an immediate hypersensitivity reaction. Antibody-mediated tissue damage occurs when polymorphonuclear leukocytes, or PMNs, bind to antibody-sensitized cells and destroy them by phagocytosis, or antibody-dependent cellular cytotoxicity reaction. Complement-mediated cell lysis happens when the antibody-antigen complex on the cell surface activates the complement pathway, leading to cell lysis. Incompatible blood transfusions are examples of this type of hypersensitivity reaction. Damage to sensitized tissue cells causes inflammation, which in turn causes damage to normal tissue cells. In type 3 hypersensitivity, also known as immune complex reactions, immune complexes are deposited on tissues, causing inflammation. This is another example of an immediate hypersensitivity reaction. Circulating immune complexes. Large immune complexes are rapidly cleared by mononuclear phagocytes, but smaller immune complexes stay in circulation longer and can be deposited on tissue cells. The immune complexes can activate complement, which can lyse nearby innocent bystander cells. They can also stimulate degranulation of granulocytes, triggering inflammation and tissue damage. The heart valves and renal glomeruli are two common sites where immune complexes are often deposited. Examples include the Arthus reaction, where an allergen is injected intradermally, immune complex disorders like serum sickness, where patients develop antibodies against heterologous serum proteins, glomerulonephritis, where immune complexes are deposited on renal glomeruli causing kidney inflammation and possibly renal failure, and vasculitis, which is the inflammation of blood vessel walls. Type 4 hypersensitivity, also known as cell-mediated reactions, are caused by soluble factors or lymphokines released by T cells. Unlike other types, antibody and complement are not involved in this reaction. Recruitment and activation of the cells take 24 to 72 hours. Therefore, this reaction is also referred to as delayed hypersensitivity. The mechanism involves lymphokines produced by T cells, which attract macrophages that become activated and degranulate. As more macrophages arrive at the site, ulceration and necrosis occur. Examples include tuberculin-type hypersensitivity, where a subcutaneous injection of tuberculosis antigen is used as a diagnostic skin test, with swelling at the site within 24 to 72 hours indicating previous infection. Another example is contact sensitivity or dermatitis, where allergens from poison ivy and poison oak cause sensitization, resulting in skin edema, microvesicle formation, and itching upon subsequent exposure. Most allergens causing delayed type hypersensitivity reactions are haptens, which must combine with fatty acids on the skin to be immunogenic.